Good morning, everyone. Thank you so much for being here with us. We're excited to have you here with us for this important conversation. I'd like to welcome all of you to the Children's Partnerships webinar on Medi-Cal call center wait times. Before we begin today's presentation, I want to hand it over to our great interpreter, Edna Santizo, to walk us through how to access Spanish interpretation services. Edna, please.
Thank you, Mayra. Good morning, everyone. My name is Edna Santizo, and I'm going to be interpreting this session into Spanish along my colleague, Nancy Gallardo. I'm going to be providing instructions on how to access interpretation. I'm going to do that first in Spanish, and then I'll follow in English. Hola a todos, buenos días y bienvenidos. En un momento vamos a iniciar la función de interpretación. Cuando esté disponible, van a ver un icono en la parte baja de su pantalla si está en una computadora que dice interpretación. Una vez que aparezca, por favor, presione y seleccione el idioma de su preferencia, ya sea inglés o español, y después puede presionar donde dice Mute Original Audio o silenciar el audio original. Si está en un teléfono o una tableta, va a haber 3 puntos en la parte baja o alta de su pantalla. Presione, seleccione Language Interpretation, el idioma de su preferencia, y también Mute Original Audio. Si tiene cualquier problema técnico, puede dirigirse al personal de The Children Partnership a través del chat. Gracias. So hello everyone. In just a second, we're going to enable the interpretation function. If once you see it at the bottom of your screen, if you're in a computer, please click and select the language of your preference, either English or Spanish, and also mute original audio. If you're on a mobile device or a tablet, you're going to see 3 dots either on top or the bottom of the screen. Click, select language interpretation, the language of your preference, and also mute original audio. If for any reasons you have any issues with this function, you can always reach out to the Children Partnership staff through the chat. Thank you.
Wonderful. Thank you, Edna. We'll also try and ensure we provide those instructions via the chat if folks need additional information. So again, thank you for being with us. My name is Mayra Alvarez, and I am the president of the Children's Partnership. For those of you that don't know us, we're a California advocacy organization focused on advancing child health equity. And we do that work through community engagement, research, and policy change. And we pride ourselves in our commitment to transformational relationships with partners in our shared work to improve child well-being. We are grateful that you are here with us today to hear about this new Seminal survey on Medi-Cal County call wait times, and to hear about this important data, and also to hear from panelists who will provide context for why this research matters to children and families. A few announcements before we get started. First, a recording of this webinar will be shared after the event. If you have a question during the webinar, please drop it in the Zoom Q&A box. We will have an audience Q&A portion at the end of the webinar, so are very interested in hearing what questions come to mind for you. And for closed captioning, click the live transcript button from the in-meeting Zoom toolbar and just select one of the options from the menu. Again, we deeply appreciate each of you being here with us today, and we want to give special thanks to the California Endowment for providing the funding to support this important research. Our organization, alongside many of you that are part of this conversation, have been actively engaged in making sure families can keep their Medi-Cal coverage, particularly after the continuous coverage protections during the pandemic ended and annual renewals returned. California, our state of California, through the Department of Healthcare Services, has made laudable efforts to streamline that renewal process and launch an outreach campaign over the past year that has helped tremendously and should be continued. Yet we know families are still facing difficulties renewing. According to the Department of Healthcare Services, 1.9 million people in our state have been disenrolled from Medi-Cal since the unwinding began. At least 350,000 of those are children, including more than 90,000 children under the age of 6 that have been disenrolled. Again, according to our own department, about 8 in 10 Californians who lose that coverage do so because of procedural reasons. This includes families not receiving renewal packets or submitting renewal forms that get seemingly lost or not processed by the county. In fact, our state of California has one of the higher rates of procedural disenrollments in the nation, meaning people are losing their coverage due to these administrative barriers, including the inability to get in touch with Medi-Cal to renew. It is through focus group research and feedback loop meetings with community organizations, which we co-hosted with the National Health Law Program, that we have consistently heard that families experienced long wait times, sometimes up to 2 hours, when they called Medi-Cal to renew or to ask questions about their renewal process. We were surprised to learn that Medi-Cal does not monitor call wait times across the state. The federal agency, Centers for Medicare and Medicaid Services, has required states to report call wait times and abandonment rates. And while we did report that, our state actually reported a statewide call center that does not provide those phone renewals and instead refers our enrollees to county Medi-Cal offices. We know that information is power, and that information can enable us to strengthen Medi-Cal for the future. Knowing this, we commissioned WestGroup Research to examine California's county call lines to better understand the experience of Medi-Cal enrollees when they call. That included surveying call centers in 9 threshold languages, in addition to English. Our intent in commissioning this work is to highlight any barriers in the process where families may encounter this difficulty, and so that together we can find ways to improve how Medi-Cal can serve its enrollees. Today, we've got a great lineup of panelists that will speak to not only this research, but again, the impact of it. First, Melanie Monroe, project director with WestGroup, will present WestGroup's survey design and findings. After that research overview, we will have 3 panelists speak to what call wait times mean for enrollees that are trying to renew, as well as feasible strategies for improving customer service, and of course, recommended actions for Medi-Cal. And then, of course, we will open it up for questions from you. So again, thank you for being here with us, and let's get into the content. Melanie, you're up.
Thank you. Okay. As Mayra mentioned, my name is Melanie Monroe, and I'm a project director at WestGroup Research. We supported the Children's Partnership with this research study, and I'm happy to share some of the information and findings from this study with you this morning. Next slide. First, I'm going to talk a little bit about the background for the research study and talk through some of the methods we used. I'll also give an update on the findings for phase 1, where we conducted audits of each county's Medi-Cal call line, and then phase 2 with the quantitative data that we collected. Next slide. As Mayra mentioned, the objective of this research was to help the Children's Partnership to better understand any issues or challenges residents in California face getting access to support for Medi-Cal renewal through their county's call line. The first phase of the research study was to get sort of a lay of the land for each county's call line, and we called all 58 counties. This also helped us to determine which counties to include in phase 2 of the data collection. And then phase 2 of the research study was where we collected quantitative data to document the process for calling each county to renew Medi-Cal as if we were residents within that county. We captured the wait times for those calls where we were on hold. And if we weren't on hold, we captured the results of those calls. For example, maybe it was disconnected due to a high call volume message and we were not able to wait on hold, or maybe it was sent to voicemail. Next slide. So briefly, in phase 1, we called all 58 counties. We made multiple phone calls to those counties to make sure that we listened to the menu in English. We also listened to the menus in Spanish and an additional 11 languages determined by the Children's Partnership as languages that we wanted to track with this research. So those varied by the prevalence in each of those counties. We also called multiple times to take different paths and make sure that we were capturing the easiest path for the purpose of Medi-Cal renewal. As part of these audits, we put together a database that compiled what the phone number was for each county, if there was an automated system or not, if there was an option specifically for Medi-Cal renewal, what the hours were. In some cases, the hours that were posted online were something different than what was mentioned in the automated system. And then for phase 2 of the data collection phase, we determined through phase 1 and those audits that there were 44 counties with automated telephone systems. And we decided, in thinking about how to distribute data collection, to call all 44 counties that had automated telephone systems. We were able to include all automated systems with from the audits with Spanish, Cantonese, Mandarin, Vietnamese, Tagalog, Hmong, Russian, and Cambodian automated systems as well. And we had researchers and staff that were able to support those languages. We called varying the times of day and days of the week. And we also started the research at the end of May, continuing through the end of June to capture calls at varying times of the month. We collected quantitative data to capture real life experiences of residents in that county. And we were trying to act as if we were reaching a representative to speak about Medi-Cal renewal. When we did reach a representative on a phone line, we confirmed whether or not they spoke the language that we were calling in, but otherwise we hung up the call at that point in order not to take away from time that they were supporting other residents. We made the decision together with the Children's Partnership that we would allocate some additional calls to counties with the highest enrollment so that we would be able to look at those counties individually. And any results overall, we did weight the data based on enrollment levels of counties. Next slide. Okay, so now we're going to talk a little bit about the results from phase 1. Next slide. So 75% of counties did end up having an automated system for managing these Medi-Cal calls. And so all 44 counties were the ones that we followed up with in phase 2. There were not any counties with a specific Medi-Cal renewal choice option in the automated system. There were some that said you could select an option for an existing case, and then in some of those specifically select Medi-Cal, but there wasn't a Medi-Cal renewal option. Generally, offices were open Monday through Friday, 8 to 5, but you can see here that was not always the case. And when they were open earlier or later, we also incorporated those times in our calls. None of the offices were open on Saturdays, so we did not make any weekend calls. Next slide. Through phase 1, there were some interesting findings looking at the challenges for people making calls in languages other than English. For example, there's a lot of messaging that's in English. So once you select your preferred language, in most cases, there is a long message in English that plays after you select your preferred language. And so that message is in English and then in the desired language. So for some of our bilingual interviewers that were listening to these automated systems, they told us that if they were really making this phone call in their language, let's say Mandarin, and that they experienced this experience of having the long English message play after selecting Mandarin, that it's likely that they themselves would have hung up because they would have assumed that there wasn't actually a Mandarin option. We obviously, for the purposes of this research study, we were doing the most. We were staying on the phone as long as possible and capturing everything that we could hear within each of those preferred language menus, but this is not always going to be the case. And some people, might have hung up before we heard that. In almost all cases, once we waited on hold in our preferred language, when it wasn't English. An English speaker came on the phone and then would need to get an interpreter to be able to speak that language. So again, thinking about Mandarin, we would reach a representative that was speaking English. And then if we asked if they could speak Mandarin, they would need to get an interpreter on the phone. In some cases, these menus, we experienced some other odd things. And in some cases, we experienced a menu where there was an English speaker in the automated system, but with an accent, or the recordings were for the automated system were reversed. In that case, we selected Mandarin and then Cantonese, and the menus were reversed. So for Mandarin, you then heard Cantonese, and for Cantonese, you then heard Mandarin. Interestingly, when we went to do phase 2, that particular issue was fixed. There were also some instances where we selected a language in the automated system, and then there was a dead end and no method to proceed. Next slide. Okay, so for phase 2, we're going to focus on some of the results for counties at different levels of enrollment. So the top 10 counties that have the highest enrollment levels are those counties that have over 400,000 residents enrolled as of March 2024. All of these numbers are as of March 2024. In this slide, there's a table to the right that shows each of the top 10 counties based on their enrollment, as well as gives us a sense of the population numbers for those counties. These are all very large counties based on population and also based on enrollment levels. Throughout the report, we then also show results with a mid-sized group. So those are counties with 100,000 to 400,000 enrollees. And that included 12 of the 44 counties that we called for phase 2. It includes about 20% of all enrollment and was about 23% of our completes. Lastly, there are 22 counties with under 100,000 enrolled, and this is again out of the 44 counties that we called for phase 2. It makes up about 7% of total enrollment. But because we called each of those smaller counties equally, it makes up about 28% of our total completes. And this is why we weighted the data on enrollment. Next slide. In phase 2, we made 742 calls, far exceeding our original goal of 600. And this slide helps to show the distribution of calls across different enrollment levels, as well as across languages. So most of the calls in other languages were completed in counties with higher enrollment, with larger populations, and where additional language options were offered. You can see that the distribution of calls by day and by times of day were fairly equal across. There were a few less calls on Wednesdays for large counties and mid-sized counties, and that's because during the time that we were calling phase 2, some of those counties ended up being closed during that time frame. Next slide. Looking at the call results by enrollment level, so looking at call results, these calls were either we were put on hold, the calls were answered immediately after the automated voice message. They were disconnected because of a message about high call volume, and then we were asked to call back later. They were sent to voicemail, or something else ended up happening, like the call center was closed early. 20% of all overall calls ended up being ended due to a high call volume message. And that's definitely something to consider, because these are residents that get disconnected and they can't even wait on hold hoping for a resolution or to speak to someone. They have to try to find a time to call back later. The offices with these results are not able to manage the current call volume with the existing staff, resources, and systems that they have in place. Looking at calls answered immediately, the highest percentage of calls answered right away without having to wait on hold were counties where there were under 100,000 enrolled. These are smaller counties. those with less enrollment, this was about a quarter of those calls, or about 25% of calls in those counties. And then the largest counties, only 5% were answered immediately without a hold. Interestingly, if you're looking at calls sent to voicemail, about 14% of calls to counties with under 100,000 enrollees were sent to voicemail. And this could be because they don't have someone readily available for calls, and maybe they have different protocols when they're experiencing high call volumes compared to other counties. Next slide. Okay, so average hold time. This table shows the distribution of hold times as well as an average hold time in the last row. These averages are based on the actual time that we held on hold. And for those calls that were answered immediately, those calls had 0 wait times. So the 0 wait was included in this average. And then for calls with extended high call volume where we were disconnected and we wanted to be able to include them in the average hold time, the way that we did that was to create a ceiling for each county. So we created that ceiling or that max hold time based on the longest call that we had in the county. We used this longest hold time to assign a high volume disconnect call hold time and have it contribute to the average. So you can see that if callers were allowed to hold during those high call volume times, potentially they could have held for even longer, but we used the longest time that we had on record for each of these counties. It's not likely that that hold time would have been any shorter. It does appear that different counties have different thresholds for when high call volume disconnect messages are administered, because we did have some counties like LA County where we never received a high call volume disconnect, even though we had calls with hold times over 2 hours. And we had counties like Alameda County that had some long hold times but also had a high percentage of our calls dropped due to the high call volume message that were then disconnected. And all of those calls, the longest hold time we had was under 90 minutes. So for some of those experiences, it seems like that county's protocol might be to send people to disconnect after 90 minutes. Overall, the average hold time was about 55 minutes. For counties with low enrollment, again, a lot of these calls were answered right away, and the average hold time for those counties was only 17 minutes. But for counties with larger enrollment numbers, it was about an hour. Next slide. And then to dive a bit deeper into the top 10 counties based on enrollment, and look at them specifically, there's some interesting things to look at across these counties. Again, I talked a little bit about Alameda County, but also San Bernardino County is another county with a high percentage of call volume disconnected calls. Alameda County has 44% of calls that were sent this message and then disconnected. And then San Bernardino, about half of our calls were disconnected due to high call volume. There were then some counties like Orange County and LA County where we never were given a high call volume disconnect message. And maybe that's not part of their protocol at all. All of our calls in those counties were put on hold. Lastly, there's some counties to highlight like San Diego that even though it's a large county and has the second highest level of enrollment, it had a pretty high percentage of calls that resulted in no wait. And they were answered immediately once we got through that automated phone system menu. This was about a third of those calls. And San Diego also had no calls disconnected due to high call volume. Next slide. So if we look at the distribution of hold times for the top 10 counties based on enrollment, and if you think about what we talked about on the previous slides about Alameda County, there's a pretty high percentage of calls, all between 80 and 89 minutes. I just think this is a good example of how this works. So I know our distribution of call times is pretty detailed as it goes mostly by 10-minute intervals, but there's a pretty high percentage of calls that were assigned 80 to 89 minutes because there's so many calls where when we called, they ended at about 89 minutes. And then there were 44% of calls that resulted in the high call volume disconnect message. And then we're also assigned that longest wait time of 89 minutes. So again, it seems like the protocol may be, we don't know, but may be that after 89 minutes, they get sent to that disconnect message. And so the average for Alameda County is maybe lower than some of the other counties like Fresno and Kern County, but it also, that system didn't allow us to hold for a longer period of time. So the ceiling was a bit lower than the ceiling in some of the other counties. And this really goes to show that we should look at this data in combination to get a full picture of what's happening at each of the call centers, at each of the county call lines. In LA County and Orange County, we were never sent the high call volume disconnect message. And so you can see here, the average for LA County is about 60 minutes and for Orange County is 48 minutes. And for those averages, we held on hold for every single one of the calls that we made. We can also see a real difference between these counties and San Diego. And in San Diego, a lot of the calls, again, were answered immediately, but also those where they weren't answered immediately had very short wait times. 10% of calls had a wait time between 5 and 9 minutes, and 13% of calls had a wait time between 1 and 4 minutes. And then 77% of calls had a wait time of less than a minute. So even when we did go on hold, we captured the amount of time that we were on hold, even if it was under a minute, even if it was 45 seconds. So that's why you see that 77% of calls in that county were under a minute. In counties like San Diego, with such high volume of enrollees, but such a low wait time, it might be important to consider what's happening there and what their protocols are to potentially learn from what San Diego is doing in other counties. The full report will have additional breakdowns of the data, but really the study overall gives us a lot of important and interesting information about what's happening for residents looking to renew Medi-Cal and their experiences calling their county. And as Mayra mentioned at the end of the webinar, I'm happy to answer any questions, additional questions about the research study and the data we captured.
Thanks so much, Melanie, for that overview and, of course, for the great work in compiling this valuable research and presentation. Appreciate you. Next, we have the opportunity to hear from Christopher Gomez. Christopher Gomez is an outreach and enrollment manager from Northeast Valley Health Corporation. He will share his perspective as a community assister, helping families renew Medi-Cal, and also share about what type of barriers families are facing and what it means for enrollees and the assisters who work with them to have to wait to connect to Medi-Cal to ensure that this coverage will continue. So I'll hand it over to Christopher.
Hi, good morning, everybody. First of all, thank you for the Children's Partnership for the work you all have done in putting together, during the Medi-Cal unwinding. The Medi-Cal feedback loop was a really, really good opportunity to share the barriers that we have here in LA and also hear about the experiences in other counties. I also appreciate the opportunity to participate in this discussion. And I found the results, yeah, really interesting. And I feel like it is very reflective of the experience we have here, at least in LA County. The continuous coverage requirement and people newly eligible for Medi-Cal because of the loss of income due to COVID-19 resulted in an unprecedented number of people enrolled in the Medi-Cal program. Once the unwinding period began and renewal started occurring, the call center wait times drastically increased. Thanks to the federal waivers that have been implemented over the months to streamline the Medi-Cal renewal process, this has eased the need to reach out to the LA County Customer Service Center but hasn't really done a whole lot in terms of the wait times, and I think that's pretty evident by the report. But to be honest with you, um, the Department of Social Services call center wait times have always been a barrier. I think because of the number of people now enrolled in Medi-Cal, and uh, I feel like that's the reason as to why we're seeing this be highlighted so much more. I've worked at Northeast Valley for 14 years, and 10 of those years have been in the enrollment space. So all of these stories that I'm hearing, and the experiences that the families and enrollers face today are pretty much the same as they were 10 years ago. It is a genuine burden for families to reach out to the customer service center. As you saw, the wait times can range from 1 hour and in many instances have gone up to 2 hours or more. And as was mentioned, there are times in which the calls do get disconnected, meaning that we have to, once again, take another hour, hour and a half to call back and hopefully get to somebody on that second attempt or that third attempt. In addition, there are times in which we have families who need assistance in their preferred language, such as Spanish, and there are times in which that we do not get a Spanish-speaking call center rep, and we get one of two results: either the call center rep gets an interpreter, or they transfer the customer or the call to the Spanish line, which adds in another length of time to wait. Many of the calls that we place are to help families verify their case status, request their benefits identification card numbers, check their renewal status, and verify that the worker has received previously uploaded documents. Additionally, the call center has informed us pretty regularly that the best way to ensure that the Medi-Cal caseworker is aware that anything was even uploaded to the case is to call the call center, so that the call center rep can send a message over to the worker. We also find that it takes multiple phone calls to the customer service center until the client's caseworker actually reviews the submitted documents and takes action on the case. Now, let's imagine a family going through this process, having to spend an hour or more out of their day during work hours because customer service center is open. I believe it's from like 7 o'clock until 6 p.m. Monday through Friday. And not only that, but more than likely having to allocate more time during the week to make a follow-up call. This time is really valuable for our families who already live really, really busy lives, going to work, taking care of their children and family. It is such a massive burden, and I feel for these families because it is such a frustrating system when what they're trying to do is really get like some basic case information, or even just the families are doing the steps to keep their Medi-Cal active, but they need to take all of these additional steps in order for somebody to even know that documents have been uploaded. It's frustrating, but let's add on another layer to that. And let's say that this family needs to take their child to the emergency room, or they need a medication refill, or has an urgent referral, but they don't know what the status of their Medi-Cal is. They don't know if it was renewed, or they find out that their Medi-Cal is terminated. Unfortunately, this is a really, really common situation that our families experience, and that they come to us for assistance because we are trusted in the community and they trust our expertise and our advocacy. In these situations, LA County does have a district liaison list, which enrollers and assisters can reach out to for assistance with urgent cases like this. But these families don't really have that option. All they can really do is call the customer service center, try their best to get through, or go to the district office, which is also another hurdle it is it, it is frustrating, and I feel that if CBOs and enrollers could have more access to case information through Benefits Cal, that could go a long way in alleviating wait times, because again, many of the calls that we make are just to verify the status of the case. In addition, the federal flexibilities that have been put in place to streamline the Medi-Cal renewal process, having those be permanent would again be amazing. Again, one less reason to reach out to the customer service center. Or even the continuous coverage requirement for children 0 to 5 years, again, would also go a long way. And that would ensure that our families are able to access services without any gaps in their coverage. But yeah, that is my piece. And yeah, I appreciate all of the work that y'all do. And hopefully we can really find a solution to this.
Thanks so much for those valuable insights, Christopher, and just speaking to the day-to-day frustrations and experiences of the families we all seek to serve. Appreciate you. Next, we have from San Diego County's Health and Human Services Agency Self-Sufficiency Services Department. We are pleased to have with us Deputy Director Adriana Ramirez and Chief of Agency Operations Yenissa Salgado, who will share how their department has developed model customer service, outlining their effective strategies for quickly connecting people to help. Again, despite being one of the top Medi-Cal enrollment counties, this survey found that San Diego County has very low call wait times. So we're interested in learning more about what San Diego County is doing right. Adriana and Yenissa, please go ahead.
Thank you, Mayra. Good morning. As Mayra mentioned, I am Adriana Ramirez. I'm the Deputy Director with San Diego County Health and Human Services Agency, Self-Sufficiency Services. And today with me is Yenissa Salgado. She is our Chief over our Access Customer Service Center. So first, we want to thank the Children's Partnership for the invitation to share best practices that have helped shape our call center operations to maximize productivity and deliver excellent customer service. Over the last few years, we have worked to adopt call center practices that Yenissa will be covering a little bit more in detail shortly. In addition, we've worked very hard to change the culture and focus on a customer service model. We work hard hand in hand with our Family Resource Center staff to ensure that the work is getting done. We want to ensure that there's timely processing. And for that, we make sure that we have month-end reminders that are sent to avoid any spillover work going from one month to the next. We know that if our back-end operations is properly handling and processing documents, this will generate less calls to the call center and ensuring that there's a prompt service to those who still need to speak with someone over the phone. Our goal is to ensure that the customers are receiving the best experience, regardless of how they connect with us. So with this, I'll pass it over to Yenissa, who will cover more in depth the practices at our Access Customer Service Center. Yenissa?
Thank you, Adriana, and good morning, everyone. Thank you for allowing us some time to present some modern strategies that we have implemented over the last year. At the County of San Diego, our primary focus is our customers, those internally and externally. Therefore, we have invested in them by adopting proper call center business and technological features to offer great customer service. So allow me to begin with our residents of San Diego. Understanding that they want to get their question answered or problem solved is our top priority. Therefore, we have built a customer service model that is simple, easy to navigate, and that they can get to an agent quickly. We use a tiered approach where we can resolve a customer's question that is primarily informational, leaving questions that require an eligibility expert for the next tier. And on average, we've been able to resolve 50% of calls within that first tier. Another customer-centered feature we recently expanded on was our callback SMS or text. We have always had our callback feature available where customers can hold their virtual place in line while they wait to be connected to an agent. However, callbacks made by agents were left unanswered. To improve our callback feature, we introduced a SMS or text message notification system. This enhancement ensured that every customer was receiving a callback or receiving a text message back. And this enhancement ensures that they would be called within the next 5 to 10 minutes. This notification allows customers to better prepare, stay alert, and be more receptive to the incoming call. Additionally, if customers are not ready or they request to, they get busy with their lives or continue on to an appointment, they can cancel that call back by replying 9. Customers have felt more confident in answering callbacks based on who is calling them back because of the timing of the text message followed by the call. Now, switching gears on our model strategies for our internal customers, I'd like to start off by highlighting our collaboration between our 13 family and community resource centers. By understanding their operations, as Adriana mentioned, we can better understand call behavior and how to serve our customers. Our team utilizes gamification to be able to enhance employee engagement and measure it by the amount of participation we see in our events. We have an expansive number of games that staff can participate. They can do it daily, weekly, and we look at the top 3 call takers per unit. In addition, we offer 2 biannual tournament style competitions, and these are completely voluntarily. And we have Access March Madness and Access Grand Prix. And winners of these tournaments gain not only pride in their accomplishments, they're also recognized with a trophy, and all staff participating get virtual coins. And on average, Access distributes a total of over 12,500 coins on a monthly basis. Staff spend these coins on their avatars, an AI-created character of themselves. And they can buy clothing for them, dress them up, or buy a virtual pet. And staff are also recognized through our Employee Recognition Awards in categories such as Super Achiever, and those are granted to staff that go above and beyond in call taking and performance in the month. Through our customer service surveys, and these are offered for our customers at our menu prompts through our integrated voice response. And these are awarded to our top 3 recipients of positive customer service surveys. And then there's Call of Fame. Calls that earn 100% call score are nominated for this. And the award is given, which shows outstanding customer service that goes above and beyond for our customers. And lastly, Heart of Gold. It's an internal nomination award given to staff who show helpfulness, expertise, attentiveness, respect, and timeliness in that month. And these nominations can be given staff to staff or staff to supervisor, supervisor to staff in all positions. These are some of the strategies that are used at the County of San Diego. And thank you so much for your time and for the Children's Partnership for allowing this time to speak. Thank you.
Thank you so much, Adriana and Yenissa, for sharing those insights and those recommendations for us. We're thrilled to learn about the work that San Diego County is doing and to find opportunities to ensure that we can take some of those best practices statewide. So lots of promising things for the future. Finally, we have Linda Way, Associate Director of Policy Advocacy from the Western Center on Law and Poverty, which is a dear partner of the Children's Partnership and has sponsored legislation to monitor county Medi-Cal call center wait times. Linda's here with us to talk about the importance of these call centers in keeping people covered and why it's important to have these metrics in place statewide. Linda, thank you for being with us. I'll turn it over to you.
Thanks, Mayra, and the Children's Partnership for the opportunity to speak. The survey findings, Christopher, and our own legal aid partners' experience of long wait times highlight the need for greater oversight and accountability of county call centers, which help people keep their Medi-Cal coverage and access to needed prescription drugs, doctor and dentist appointments to stay healthy. For over a decade, and certainly exacerbated by the pandemic, people receiving or applying for Medi-Cal have struggled to get a hold of their county workers by phone. Inability to reach the county by phone has had a negative impact on Medi-Cal eligibility due to the public health emergency unwinding, where for the first time, over 13 million Californians' eligibility is being redetermined. Many of these cases have not been touched for over 3 years and may have incorrect contact information. When Californians can't get through by the phone, they often cannot complete a Medi-Cal application or renewal, reinstate their Medi-Cal, or make other corrections, despite both state and federal law that requires people be allowed to do these things over the phone. Although there are multiple ways to contact a county, hundreds of thousands of Californians rely on call centers. In fact, people often try mailing or submitting information online before calling the county as a last resort. California can and should do better, which is why we have co-sponsored Senate Bill 1289, championed by Senator Roth. This bill would require the Department of Healthcare Services to collect and publicly report county call center metrics, including call volume, call wait times by language, and call abandonment rate. This is basic but critical information that provides an opportunity to better understand and resolve barriers and county-specific issues. I was thrilled to hear of some of the advances a large county like San Diego has done to improve their response rate. Counties can learn from each other, and a systematic way to help counties improve their response rate is to, 1, measure county call performance, and 2, hold them accountable. Senate Bill 1289 would also require the department to develop statewide minimum standards for county call centers, providing ample time to develop these standards and following the call center data report. The bill is making its way through the legislature and is critical to ensure eligible people are able to speak with their worker to keep their Medi-Cal. Thank you, and I'll pass it back to Mayra.
Thanks so much, Linda. Thank you for your leadership and partnership. And we look forward to continuing to support this legislation and working together to improve Medi-Cal for the future. I know we're a little bit over time, but we do want to open it up for questions and take about 5 minutes to answer a question that I will pose first to WestGroup, but really open it up to each of our panelists to respond and provide your insights from the hat that you're wearing. So first, Melanie, it's interesting, in counties where callers couldn't get through to speak to someone at all, can you speak a little bit to what happened and if there were callback options given? And again, to our panelists, I would love to hear more of your insights. Christopher, from your role as an enrollment assister and working with folks directly, for our San Diego County leaders, talk about what the process is in San Diego County. And then Linda, if you could speak to the policy opportunities there are to ensure that these sorts of other opportunities to keep people covered can be identified. So Melanie, starting with you, again, what are those options when someone can't get through to speak to someone at all, and what happens?
Thanks, Mayra. Yes, so when we got that message saying that there was a high call volume and it was disconnected, when that happened, that was just there was just a message asking the caller to try to call again later at a different time, indicating that there was currently a high volume of calls and it was too high, and then it would just disconnect, dead end, no additional information, no additional specific information on a better time to call back, no indication of another phone number to try, just disconnected with that message. That was our experience.
Thanks, Melanie. Any other panelists want to chime in on that question?
Hi, this is Yenissa. I'd like to tackle that. And then also there's a question on the Q&A portion for the tiered approach. And so I think answering through that will answer your question, Mayra. But as I mentioned, over 50% on average, over 50% of calls have been handled in tier 1. And what we found was that a lot of our customers were calling for something as simply to check the receipt of their document, right? Or get informational type questions. And with San Diego County, our tiered 1 is used for that. That's what they're for, to answer those questions that are prompt questions that our agents can handle. And more of the technical eligibility questions that customers have in regards to the increase, decrease of their eligibility or what happened, that would go on to the next tier. And so making it accessible for our customers to get into our call center and speak to an agent, that's ultimately what we want our customers to feel and have their issue resolved. Thank you.
Thank you. That's super helpful. So another thing that's come up in the chat quite a bit has been the difference in call response time and or availability of translators based on the needed language. There was some promising data showed for Spanish speakers, but Melanie, could you speak a little bit to that difference in call response time? And again, opening it up to other panelists around the importance of language access, particularly in the enrollment process and in the work to make sure we have access to coverage and services.
Sure. So there, in terms of English versus Spanish, one thing I didn't specifically say in the presentation, but we did, when the representative answered the call, we did verify if they spoke Spanish, because oftentimes they answered in English. Well, every time they answered in English. And then when our bilingual interviewer would ask if they speak Spanish, they did. In our cases, I know from what Christopher said, this isn't always the case, but they did speak Spanish back to our interviewer. I'm not sure why the wait times might be longer for other languages, but there is also that issue that we were experiencing where even when you get the representative on the phone, they are not the end person who is able to be the interpreter. And from our experience, we were getting representatives answering in English and then needing even further time to get an interpreter on the phone, which makes those waits even longer. And it sounded from what Christopher was saying, like that's the experience other places as well. I hope that answers your question.
That's helpful, Melanie. Thank you for that. I'm going to try to squeeze in one more question. There's a lot in the Q&A about DHCS and the role that DHCS can play in motivating other counties to follow these processes or in motivating them to replicate the county model. And Linda, I'm gonna throw this at you, just recognizing your role as an advocate and work with community organizations across the state. What are your thoughts on the opportunity for DHCS to take some valuable lessons learned from this data and the role of community organizations in motivating their own respective counties and trying to follow the lead of counties like San Diego?
Great question. And as the statewide agency overseeing the Medi-Cal program, the Department of Healthcare Services has a huge role in terms of making sure that it's operating as intended. And I know there have been some county collaboratives, and so that's certainly one way that the department has sought to increase this. But really, the fact that this data, very basic data, as you noted, it's surprising that it doesn't exist. And so how do we really able to pinpoint pain points and resolve those issues. And so being able to actually have data across the state is important. And then having standards to hold counties actually accountable, so that we're actually doing something with the data. It doesn't just exist there. And we know that there can be wait times of that exceed 5 hours. And so how do we address that and ensure that all counties are able to meet basic minimum standards?
Absolutely. Thanks, Linda. And we're excited that DHCS actually has heard this data. We gave them a preview of this data and they were incredibly receptive. And again, trying to identify what sort of takeaways they can get from this information in order to improve Medi-Cal for the future. So lots of work ahead for all of us together. Again, I just want to thank WestGroup for their incredible research and each of our panelists for the eye-opening conversation. And to our panelists and to each of you on this webinar, our deep appreciation to you and everyone who works so hard to keep California families and their children enrolled in Medi-Cal. We're going to put a link to the full report in the chat. And if you have any questions or want further information, please do not hesitate to reach out to the team at the Children's Partnership. We look forward to working together, again, to improve Medi-Cal, to strengthen it for children and families, and to ensure that California is doing the best to prioritize the health of our children. Thank you. Have a great rest of your day.